I'm Dr. Art Mollen. Welcome to Hope You're Feeling Good. I've practiced medicine for over 50 years and seen the face of medicine go through a complete metamorphosis. Physicians have more diagnostic options and tools, however, less time to personalize patient care. The healthcare landscape has become more difficult to navigate, so you'll need more information to advocate for yourself. I'm here to answer your questions as well as educate you with the latest breakthroughs in medicine. At the end of the day, I hope you're motivated to take better care of your health. Welcome to Hope You're Feeling Good. I'm Dr. Art Mollen, and I'm here to answer your questions. So here's what's on my mind. First, I want to talk about bodybuilding supplements. So if you're out there and you say, hey, I want to gain some weight, men can usually gain 1.5 to 2 pounds of lean body mass in a month. Women can gain about a pound to maybe 1.5 pounds during that period of time. But do you really want to take these bodybuilding supplements? You have to be careful depending upon what type of supplement you're going to take. So as I research this, whey protein may be the way to go. Whey protein, spelled W-H-E-Y, is something that's sold in most health food stores and many drugstores as well. It's absorbed very, very quickly into the body. So that's why a lot of the bodybuilders are using the whey protein over some of the other supplements. I get concerned about other supplements that are sold, such as DHEA, creatine, that's another issue. If you take too much of that, it can affect kidney function studies. It can affect your liver when you're taking too much on a regular basis. And the other one is HGH. HGH is human growth hormone. This is a hormone that is often given and prescribed by doctors when children have short stature. But it's been used actually in bodybuilders to actually enhance their overall body mass. So this can be a problem because it's injectable. Sometimes it's sold somewhat illicitly, so you have to be careful of that, and depending upon what type of supplement you're actually getting with the HGH. But it can cause conditions known as acromegaly. Acromegaly can make your head enlarge. It can cause your hands to become larger. It can cause carpal tunnel syndrome. It can affect your liver. It can affect your pancreas. So you have to be careful when you're taking any of this HGH, particularly if you're taking it on a regular basis. Sometimes they load up and they'll do it for 3 or 4 weeks, and then they back off for a period of time. So if you're using the HGH, you got to be careful with it if you're a bodybuilder or if you're someone just trying to increase your strength and overall stamina. So when it comes to supplements, just be careful. We have a saying in Latin, caveat emptor, Latin for buyer beware. The next thing's on my mind is anxiety. Anxiety in children particularly, because a recent study I read suggested that after children reach the age of 15, 50% of them have certain types of anxiety. Now, this could be general anxiety syndrome. It could be phobia of whether it's a phobia of snakes, it could be a phobia of going to school, which I'm sure a lot of children have, or it could be separation anxiety even from parents. The other type of phobia is called social phobia. So that's this individual that, say, goes into a room and has to give a speech in front of the class. So they get very nervous, they get anxious, their heart rate starts to elevate, they get somewhat tense. So social phobias are something that people often recognize that they're having that experience, but they don't know what to do for it. So what is the treatment for this? And why do we want to treat it? Well, we want to treat it in children particularly because if we don't treat it early on, it's going to exist into adulthood. The other thing, we find it particularly common with a hereditary condition. So if the father had it, they often pass that anxiety on to the son. If a mother has it, she often passes it on to the daughter. So it's gender related in that respect. The treatments I often recommend are SSRIs. These are selective serotonin reuptake inhibitors, medications like Lexapro and Zoloft and Paxil. These medications can be taken on a regular basis. They help to reduce that anxiety. The other thing that you could take just on a irregular basis, and just if you're going in to give a speech, you could ask your doctor to prescribe a beta blocker. Beta blockers slow down your pulse rate, lower your blood pressure, and they can reduce your anxiety for a period of several hours. So it's something that a lot of actors and a lot of singers have taken over the years to reduce their stage anxiety that they often have. So that's something that you could do. The other thing is called CBT. So this is cognitive behavioral therapy. I like cognitive behavioral therapy because that helps to reduce anxiety without taking any medications. I particularly like that for children because the less medication we give children, the better off they're going to be. And the final thing is alcohol. Do you drink alcohol on a regular basis? You probably heard all the studies that suggested that if you drink alcohol, it's really good for your heart. It's going to reduce the risk of heart attacks and strokes. But again, we talk about moderation when it comes to alcohol. So moderation in alcohol, what does that actually mean? Well, it means for women, 1 drink a day. For men, no more than 2 drinks a day. Moderate alcohol, a lot of people think that may be a 6-pack, but I can tell you right now, it's not a 6-pack of alcohol. Now, alcohol does increase HDL, that's the good guy cholesterol, but the overall devastating effects of alcohol on a long-term basis, number one, the potential of dependency, the addiction to alcohol, the potential to be a binge drinker, the potential that alcohol does increase the risk of breast cancer. It increases cirrhosis of the liver. It can increase the risk of pancreatitis. It also increases esophagitis and also esophageal cancers. So alcohol on a regular basis, I can tell you right now, regardless of what you may hear about potentially being good for your heart and 1 glass of wine a day, I don't have any scientific evidence that I'm going to present to you today that's going to corroborate that and suggest to you. So if you're not a drinker, don't start drinking. And that's what's on my mind. Well, the doctor is in, and I'm here to answer some questions. The first one is from Larry, and he recently went to the ER because his blood pressure was really high, 180 over 100. He was evaluated for a heart attack and strokes, and that was all good. And he had blood work. He said that was even positive. They treated him with several medications, got his blood pressure down to 148 over 90, and then they sent him home and told him to see a cardiologist. Well, the doctor said he may need 3 different medications to keep his blood pressure down. Then he admitted to me that he did have a 6-pack of beer that night and lots of chips because he was watching a baseball game. He said, what should he do for his blood pressure? Is it going to continually be high? You know, well, the first thing, Larry, is to stop drinking 6-packs of beer on a regular basis because that has a lot of sodium with the chips, and that's going to elevate your blood pressure. So what I usually suggest for people to keep their blood pressure down is lower the amount of sodium in their diet. If you can keep your sodium level down to 1,500 milligrams a day, that's going to control your blood pressure remarkably well. Also, if you exercise on a regular basis, that's going to help to keep your blood pressure down. You may need a medication because even 148 and whatever they were able to get it down to, regardless of what medication they gave you, that's something that you probably want to keep an eye on long term. And please don't drink a 6-pack of beer or you'll be in that ER every single night, Larry. My next question comes from Mark. And he said his right eye became rather swollen and red after he was on a flight from Los Angeles. It was about an 1.5-hour flight, and he's wondering what he could take. He does take some medications on a regular basis, wondering if that might have contributed to it. Well, Mark, it sounds like, and I saw a picture of your eye, and it looks like you had what we call a subconjunctival hemorrhage. And that's basically bleeding of small blood vessels in your eye. Usually this is not a serious condition, It's not going to be that pernicious. You're not going to have necessarily a long-term problem. But if you're taking any type of blood thinners, if you're taking any other medications, even if you're taking aspirin on a regular basis, it's going to cause potential to have that subconjunctival hemorrhage and those small blood vessels in your eye. It takes several days to resolve. It's probably going to get a little yellow as the blood is resolving, but usually within a week, that eye should look a lot better and you should be fine. My next question is from Michael. And so Michael's been having a cough, and it's been over the past 6 weeks. He's been tested for COVID, and he said it was negative. So that's good, because we know COVID is still rather rampant, particularly the Omicron strain, which seems to be ubiquitous, and everybody's picking it up regardless of whether they've even been immunized. He says he doesn't smoke, but he does live in an area where a lot of building is going on. And he's wondering if the dust in the air could have been just causing that. He states he's had a little bit of shortness of breath, but nothing serious. In addition, he recently started taking a new blood pressure medication, and he's wondering what he should do about it. So chronic coughs are something that need to be evaluated. If someone has not had a cough on a regular basis, they need to see their doctor. They need to have at least a chest x-ray. If they're over a certain age, if they have a history of smoking, they should not only have a routine chest x-ray, but a screening CT, a CAT scan of their chest, just to make sure there's no underlying neoplasms, any tumors. So when persons have a chronic cough and they live in an area where there's a lot of construction, one of the things we have to look out for is known as valley fever. This is very, very common, and it comes from fungal spores. It's treatable, but you want to treat it early before it starts to cause a certain degradation of your lung tissue. So valley fever is something. It's usually treated with a medication called diflucan. It's commonly seen by pulmonologists. They'll do various tests. They'll do CAT scans to make sure that it's not becoming more extensive into your lung fields. So valley fever is a possibility. One other thing, I see it with certain blood pressure medications. Lisinopril is a medication that's commonly prescribed for high blood pressure. I have found in some of my patients over the years, after taking lisinopril, say for a couple of months, they can develop a chronic cough. So if that's the case, and this is a new medication that you just started to take, then I'm going to suggest, Michael, that you basically see your doctor, maybe stop that medication, let him prescribe another type of blood pressure pill for you, but absolutely get a chest x-ray and be evaluated for valley fever. And again, we can't rule out the possibility that it's just allergic bronchitis, which a lot of people do get. So that does it for our questions and answers for the day. And if you'd like to leave an audio message for me and a voicemail, go online and it's speakpipe.com, ask Dr. Art Mollen. And now it's time for family medicine. And the reason they call it family medicine is because if you're a doctor, I can tell you right now that you always have a family member who's asking you a question or texting you and showing you pictures of what's wrong with them. And today I'm honored to have my daughter, Jenny Mollen, a best-selling New York Times author, City of Likes, her most recent book. And she's going to ask me a question and talk about one of her medical problems that we've been addressing over the last 30 days. So, Jenny, welcome aboard.
God, it's not even the last 30 days. I mean, like, you're going easy on me. I've been bothering you about this for, I would say, the last year. I feel like it's almost been a year and a half since my grave thyroid issue came back. I've had this gut issue and I swear they're connected, but every time I read about it, it seems like, I don't know, only people with Hashimoto's have gut dysmobility. I have Graves, so like I should have diarrhea. Where is my diarrhea? I'm waiting for it. It's not coming. And I've tried everything. I went to a bunch of functional medicine doctors. I've been on the berberine. I've been on the microbial. I can't even pronounce it. The microbials. I did a sort of a
Probiotics
low
and all kinds of
FODMAP
things. Yeah,
diet.
I remember. Yeah.
I've done everything, Dad, and nothing seemed to work until recently. Before I went to Germany, you said to me, "You need to get back on Zoloft,
And stop everything else.
and it would affect everything else."
Yes.
And I thought, okay, I don't know. I'm desperate. I'm really desperate this time. Maybe I'm going to actually listen to him, because sometimes I do like to get a lot of advice from a lot of people and then like not listen to any of it. It's the curse of being a doctor's daughter.
That's
But
true.
I did it. I listened to you and I took the Zoloft, and I even upped my dosage while I was on the trip, because again, like I think that I have my own medical license. And it has been miraculous. I feel so happy, and my stomach is now like flatter than it's been in the, I don't know, maybe even like 4 years.
Yeah.
It's crazy.
And we talked about a couple things because you were having all the bloating and you had tried all
Bloating
the
was
the FODMAP diet and things that they
yeah.
suggest for irritable bowel syndrome and probiotics and so you were
Yep.
taking all these other things and you had eliminated eating bread and I said you
Oh
needed to
yeah, I was
get back
grain
on
free.
start eating glutens again and just to allow your body because when people follow these diets and they get on restrictive diets for a continual period of time, they don't realize that you're only supposed to be on those diets for, maybe a couple of weeks, but not for months at a time. And that can actually upset the balance in your gastrointestinal tract and in your colon and everything because you're killing off all of the good bacteria as well.
Totally. And that's what I felt like I did. I felt I had to get on Cipro when I was, well, I didn't have to, but when I was away and I got that stomach bug and they prescribed me Cipro and it killed everything in my body. I felt amazing. And then I felt terrible again. So I feel like, I was missing some key components, serotonin and good bacteria.
Yeah. See, and the one thing that people don't understand is, and when you're taking the SSRIs, which are selective serotonin reuptake inhibitors, so they affect the serotonin in your body. Well, 90% of the serotonin in your body is actually in your gut. And the other 10% is actually in your brain. So it's a separate thing. You have serotonin in your brain and you have serotonin in your gut. Well, the serotonin in your gut doesn't necessarily transmit and go over the blood barriers and go to your brain, but there's like a black box formula there. And so there is a connection. And so for you, you were coming out with the best-selling book and City of Likes, and you were under that stress, and you're a media influencer, and you're doing all of that and posting things every day, and people don't understand an inordinate amount of stress that goes into that. And I could see it in you that you were just stressing yourself out to a maximum because you exercise a couple hours a day, and so you're trying to combine all of that, and you're dealing with two children, a soon-to-be 5-year-old, an 8-year-old who will soon be 21. So you're dealing with a lot of issues there. So and you're coming out.
And I'm living in New York City.
And you're living in New York City, and again, so they don't have a backyard. So you're dealing with a lot of stresses, and so people don't understand that. So taking one of these types of medications, whether it's Zoloft or Paxil or Lexapro, one of those types of medications, which are selective serotonin reuptake inhibitors, that's really important for people to do. So I think the most critical thing is taking these medications and realizing, because over the years I've treated this type of irritable bowel syndrome with these serotonin uptake inhibitors. So that's really important.
But why does nobody know about this? Like, why aren't more gastro guys doing this? Because I guess you're using it off label a little bit, but it feels like if it could help so many people. Why aren't more people using them in this way?
That's a great question, and I've seen a few of the gastroenterologists over the years who have recommended these types of medications because it is somewhat off label, but it's certainly a medication that has been in the literature and been successful for people who have other irritable bowel syndromes, and what they don't understand is that connection between anxiety and what it has to do with your overall digestive system.
Yes, it's so true. It's so true.
I'm
I mean,
thrilled
I was
to see you
twitching.
doing
I
so
was
well.
feeling the anxiety.
Yes. Yeah. Well, I'm thrilled to see you doing so well, and your next book that's coming out after City of Likes was eighth on the bestseller list, and you've been a success with that. And the next book is called Dictator Lunches, and has to do something with that 8-year-old who's again soon to be 21, where
The
he did
dictator. Yeah.
the
Yes.
so-called dictator, and we're I'm excited for you and very proud for you, and I'm just so thrilled that taking this medication has been a success for you.
It really has been. I mean, nobody could figure it out, Dad. So I'm so grateful that you suggested it.
Well, you have a wonderful day, and I love you. And
I love you. I'll call you in the next 10 to 15 minutes with my new issue. Okay.
okay, and Jason can call me with all of his medical issues as well. So,
Okay, perfect.
and that's why we call it family medicine. Well, that was great hearing from my daughter, Jenny, with her questions, and hopefully you'll be sending in more questions as well. But here's my final tip of the day. Positive mental attitude. I can only tell you that a positive mental attitude is going to enhance the effectiveness of your immune system. It's going to give you more energy during the day. You're going to sleep better. And it's easy to be negative. It's more difficult to be positive. But I hope you're feeling good.